Good morning to everyone in the USA. Good afternoon to people in Europe, and a good evening to people in India and the Asian countries. It's wonderful to be here today, especially when I see quite a few of my students are also online and they are here to listen to what I have to say. I'm going to talk about a condition that I have treated quite often. Many of you who are attached to homeopathic hospitals or who are actually handling homeopathic hospitals might also come across these cases. And it's very interesting that homeopathy can help in conditions that otherwise sometimes can be incurable. And the condition that I'm going to talk about, as you all know, is treating the unconscious patient or a person who comes to us in coma. Though actually, it would be correct to say that we need to go to see this patient because he is in an unconscious state. Let me start with the screen. Recently, we had a meeting of our California Homeopathic Medical Society, and we were discussing webinars. And one of our members brought up a very pertinent point, which I completely agree with. She said that most of the webinars I've been attending recently, of course, right now with the COVID-19, lots of people are coming up with webinars as one way to communicate with other homeopaths. And she said that what her understanding or what her takeaway from the webinars was that each homeopath was just trying to project himself as the master of homeopathy. That's a very important lesson for all of us. And I'm going to talk about homeopathy and not about me. So I'm not going to tell you what I have been doing, but what homeopathy can do and how you can use homeopathy to treat unconscious patients. Basically, my approach has always been an integrated approach. As a teacher, I used to teach homeopathic Materia Medica with integration with pathology, with medicine, with gynecology, with surgery, so that you understand the drug or you understand the remedy and you can really use it in practice. Now let's start with coma. What is coma? Today I'm going to talk to you something which is more clinical and very important because I'm going to try and correlate the different pathological states and the homeopathic remedies for it. I am a firm believer of constitutional treatment, but there are certain conditions where you need to give certain remedies which are going to act more on pathology or they're going to act more on a particular part. And then we later follow up with maybe the constitutional drug. So coma is a state from which the patient cannot be aroused by stimulation and no purposeful attempt is made to avoid painful stimuli. It's a very simple thing. The patient is just lying there like a log. You try to press somewhere on some of the known painful parts. If it is a person who's awake, he's going to push your hand away. But this person makes no attempt to avoid such painful stimuli. Now, what we are not usually aware of, or what we don't really keep in mind, is that our state of consciousness, it consists of two parts. One is the wakefulness or alertness, and the other is the content or awareness. So these are two different aspects of our state of consciousness. Let's pick up each of these because each of these are very important for us as homeopaths. And we have different remedies for people whose state of wakefulness is affected and those where there is a problem with the content or awareness. So the wakefulness or alertness, how is that maintained? There is a part of the brain called the reticular activating system. Now, this is not an anatomical part. It's not just one spot like you have the speech center in the brain. And if that is affected, you can't speak, or you'll get aphasia, or you get dysphasia. But this is a diffuse system of the upper brainstem neurons and the thalamic neurons. And from there, it spreads all over to the cerebral hemisphere. So it's like this. As you can see, you have this is the area where you have these neurons. And from here, it spreads all over. So what does this tell us? That you need to have a major insult, a major pathological damage to produce a problem with wakefulness and alertness. Now, what about the content or awareness that we all have? Now, this depends on the integrated and organized material thoughts, subjective experiences, emotions, and mental processes. Now, each of these are in anatomically defined areas of the brain. So this is the difference. To be wakeful or to be alert, you need a lot of different areas and pathways that should be affected together. But for content and awareness, there are certain special areas in the brain which can be affected. So a small lesion can produce a problem with awareness. Usually what happens is that if you have a problem with maintaining a coherent sequence of thought, you call this confusion. And we have rubrics in the repertory where confusion is very well illustrated in most of the repertories. So generally, if you have confusion, it indicates a metabolic derangement. Certain pathological, focal, neurological deficits can make the patient appear confused. But in general, when a person is confused, you would think more of a metabolic cause. And that helps us look at different remedies. So you would look at remedies which have an affinity to bring about changes generally in the body compared to those which have got a focal neurological deficit or an infarction. Now let's look at the underlying pathology that causes coma. Now, because we saw that a person can be alert if the whole of the reticular activating system is affected, you need to have bilateral hemispherical damage. Just one small area of the cerebral hemisphere will not cause unconsciousness. So when the whole of the cerebral hemisphere on both sides are affected, then a person can become unconscious. And that doesn't happen with a damage to the brain, because you don't normally see such global damage. But drugs and certain toxins can bring this about. And we have remedies, again, for such conditions. I'll talk about the remedies later. I'm going to give you anecdotal cases. We have a very short period of time to talk about how to have a framework to treat unconscious patients with homeopathy, a framework to success. So I would prefer to give you more information about the homeopathic remedies, the correlation with pathology, correlation with medicine, and just give you anecdotal cases which will give you more of examples. I don't want to go into details of cases today. So the other underlying pathology is a problem that affects the brain stem. And when the brain stem is affected, either because of maybe an infarction there or some metabolic derangement, then you might get the problem of the patient going unconscious. So if the patient has unconsciousness because of a pathology in the cortex, there are three ways of this happening. One is when there is a generalized hemispherical lesion like encephalitis, generalized epilepsy, drugs, hypoglycemia, global brain ischemia. Or you might have a very large tumor or a secondary brain swelling, which is initially on one side, but as it enlarges, it also compresses the other hemisphere. So that means both the hemispheres are now damaged and they will lead to unconsciousness. Or sometimes there might be one very large lesion in one of the cerebral hemispheres and it actually now presses down on the brainstem. So indirectly it causes coma because the brainstem where the neurons of the RAS are situated are now affected. Now, usually if the reticular activating system is affected, you have lesions that are in the brainstem. And the lesions that are in the brainstem will usually cause pupillary reactions and the eyeball movements. These are going to be affected. I'm sure you know all this. That's why I'm not going to go into great details about doll's eye movement in examination of the CNS. But it's very important for us to keep this in mind because our homeopathic remedies also have certain changes. And those changes are what we are looking at when we are making prescriptions in a patient who has unconsciousness. So just to make it easier, if there's a lesion in the midbrain and the third nerve nucleus is affected, you will find that the pupils and the reaction to light are affected. If the pons is affected, then the spontaneous and the reflex eye movements and the corneal reflex are affected. If the medulla is damaged, then the respiratory and the pharyngeal responses are affected. So this is going to help you find out where the lesion is. We have location, sensation, modalities when we are taking the history in a patient. Out here also you have location, what is a site, the sensation is and particulars, so the pathology, and what is the mode of treatment. Here we are looking at homeopathy. So we are trying to now correlate these changes we see in the patient with the homeopathic remedies. So to sum it up, what are the causes of coma? It could be a late development during the course of a disease, like systemic infections, affections of the central nervous system, tumors of the brain or abscesses, auto intoxication, exogenous poisons, and cerebral anemia. If it's a sudden onset, most of the time there's a head injury or a cerebrovascular accident, what is commonly called a stroke, different drugs and poisons, some fulminating cerebral infections. Again, endogenous poisons, that means toxins produced within, especially when a person goes into conditions like septicemia. Certain physical agents like heat, it could be post-epileptic, it could be hysterical, where drugs like your Ignatia or Moscus could be thought of, or as a result of neuralgia and severe pain. Pain causes fainting is a remedy, is a rubric that you must look for. Faints from pain, you could think of drugs like Heparsil, you could think of drugs like Viratrum album. Now, so for us as homeopaths, why do we need to examine? Because we need to first find out the level of consciousness, try and find out whether it's a systemic disease or whether there's a primary disease of the brain. And if it's a primary disease of the brain, find out which part of the brain is affected. Because when you know these first top 3 points, Then you can identify the homeopathic remedies for each of those conditions or each of these different causes. So let's look at the level of consciousness. In all our books of Materia Medica, you will find in some or the other remedy, the patient is either drowsy, or he is stuporous, or he is in a state of coma. So what is the difference between these three? They all are basically different shades of loss of alertness or wakefulness. So that means there's something to do with the reticular activating system. Let's start with drowsiness. So here the patient appears to be sleeping. Stimulation will rouse the patient to a state of complete wakefulness and cooperation, but he then sinks back into sleep if the stimulation ceases. Now this indicates an upper brainstem disturbance, or it's a reaction to drugs. Now, which are the drugs that we have studied in our homeopathic Materia Medica for drowsiness? One of the most important is antimonium tartaricum. I am going to digress a bit right now, though I had planned not to do this, because I think it's worth giving you some understanding of how I look at homeopathic Materia Medica and how I study and teach the Materia Medica. So antim tart is a patient who is drowsy. If you remember, the patient has a death rattle. That's what it's commonly remembered for. The patient is blue or cyanosed, and the patient is extremely irritable. So a drowsy child or a drowsy old man, very irritable, turns blue on the lips, the extremities turn blue, and the person has a death rattle. Now, all these are symptoms of a condition called hypercapnia. Hypercapnia is carbon dioxide retention. So because of the fact that this patient's lungs are affected, he's not able to have a proper exchange of gases. The carbon dioxide content in the blood starts rising. When it finally reaches or crosses the blood-brain barrier, that's when you find the antim tart state comes in. So you find antim tart will have drowsiness more because of hypercapnia. We know apis is a remedy again for drowsiness, but we also know that apis is a drug when a person has encephalitis or when there is meningitis. So this is what you have to look at. Try to find out what is the pathology in your drug. See what is the peculiar, queer, rare, and strange symptom in each particular remedy and how it correlates with the person's pathology and with any PQRS that you see in the patient's condition. What is stupor? In stupor, on vigorous stimulation, the patient can be sufficiently aroused to resist the painful stimuli, or even for short periods to respond to commands or to answer simple questions. Now, this is where you'll remember we have arnica and baptisia. Arnica, you rouse him up, you ask a question, and he will answer correctly, and then he will fall back into sleep. While baptisia, in the middle of the answer, he goes to sleep. So both of those remedies are remedies for the state of stupor. So they're not going to be useful in the drowsy state, which is one state milder than the state of stupor. This usually indicates a bilateral hemispherical disease. It could be anoxic, it could be toxic, or it could be traumatic. So if you look at trauma, arnica fits that. It's a drug for head injuries, for concussions, and the patient becomes unconscious. It's also a good drug for toxic states, septicemias, septic conditions, typhoid fevers. Same with baptisia, toxic conditions for sepsis, for typhoid. Phosphoric acid, another remedy where you have a person who lies like a log who seems to be indifferent to what's happening around him. In this patient, the family might be able to give you the history of maybe grief, disappointment in love. And following that, the patient's condition gradually deteriorated and he has now gone into the state of stupor. In acid fast, you might also find that there's a history of diabetes and he has gone into maybe either he's gone into ketoacidosis or he's gone into a diabetic coma. So you need to look at your patient's condition. Don't just treat only on the basis of symptoms. Look at the symptoms, look at the patient's, what could be the causative factor. Look at the pathology. See if it correlates with the homeopathic remedy you're thinking of. That would give you a much better response. Carboveg is a remedy for the anoxic type of hemispherical damage because of lack of oxygen. And that's when the patient becomes stuporous. Now, the third is deep coma. Now, this is the state where you cannot rouse this patient to any degree of cooperation. He's in deep unconsciousness. He's immobile. He can be incontinent. This usually indicates the pontine and the lower brainstem lesions. So if you look at each of these, drowsiness is the high brainstem. So look at the anatomy. You can actually see how as the different areas of the brain get affected, the level of consciousness also gets worse. So if it's just the higher brainstem, it is drowsiness. If it's the upper brainstem and the mid brainstem, you think of stupor. When it's the lower brainstem, you think of deep coma. And now you can also look at the homeopathic remedies and say that maybe Nux moschata, Helleborus, Gelsemium have an action on the higher brainstem. Drugs like Baptisia, Carboveg have an action on the upper brainstem and the mid brainstem. And the lower brainstem and the pontine area, the remedies that we can think of are opium, belladonna, hyoscyamus, stramonium, uriatic acid, cuprum, plumbum, zincum. All these different remedies go into a state of deep coma. Now, if you remember the causes of unconsciousness, we said it could be post-epileptic. And that's where cuprum, zincum met, stramonium, and belladonna could be thought of. Apart from the fact that it could also be as a result of infections in case of belladonna, in case of stramonium. So when the brain has been affected by some fulminant infection, you could think of those remedies. So you find that almost 70% of cases of coma are metabolic in origin. Either they are diabetic comas, they are hypoglycemic comas, or they are metabolic comas that have had a drug overdose. Only about 30% of the cases that you will come across in your practice are those that are caused because of some actual intracranial catastrophe or damage. So it could be a stroke, it could be either a hemorrhage or an embolism or a thrombus or some sort of an infection which will cause this particular patient to go into a state of coma. Now, in all these cases, the pupils will give us a clue to the type of coma, and those pupils are also going to give us a clue to the homeopathic remedy. So let's look at the pupillary reaction. If you remember, we had talked about the fact that the midbrain and the third nerve nucleus, they are the ones that are responsible for the reaction of the pupils. Now, whenever you are examining the central nervous system, the first thing you write is higher functions are normal. And when you write the higher functions are normal, you write about the patient being conscious, cooperative, well-oriented in time and space. So that's something to do with the alertness and the awareness. Next, we talk about the pupils are central concentric, and equally reacting to light and accommodation. So when you do the CNS examination, even in a normal patient who's not unconscious, you always look at the pupils, and the pupils give us a clue to the diagnosis, and the pupils give us a clue to the homeopathic remedy. So if the patient has normal reacting equal pupils, they are both of equal in size and they are normal reacting, then the cause is most likely metabolic or toxin. The only exceptions to the toxins is amphetamine, which causes dilated pupils, and opiates, which cause constricted pupils. If there are unequal pupils, this means this case is outside the scope of homeopathy. When one pupil has become dilated and the other is not, then you know that this is because there's most likely a herniation of the temporal lobe. This patient needs immediate surgical attention. He's definitely going to go towards the state of death. If both the pupils are dilated, it could mean that the patient's chance of recovery is remote. It also means that this patient is in a state of cardiac arrest. So if you see both the pupils are dilated, most likely this patient, if it's a CNS problem, he is not going to respond to homeopathy. But some of these patients have dilated pupils because of toxic conditions. Some of the diseases that can cause this state, and such patients can be treated with homeopathy. And the remedies for bilaterally dilated pupils would be belladonna, gelsemium, hyoscyamus, stramonium, acid phos, and iodoform. Now, belladonna and stramonium both have dilated pupils. But the important thing is that though they are dilated in these patients with toxic causes, they will react to light. They won't be completely dilated and not respond at all. And the difference between belladonna and stramonium is that in stramonium, you need very bright light to bring about a change in the pupils, to bring about a reaction in the pupil. So though both appear to be similar, both will have the red face, the glistening red eyes. In case of stramonium, you need extremely bright light, and then you will see that there's a change in the size of the pupil. So that's how you might be able to differentiate the two remedies on the basis of science. This patient is not going to tell you anything. He's unconscious or she's unconscious. You have to rely only on your clinical findings, on your examination findings. And this could be one peculiar finding that might help you differentiate the two remedies. The other thing that we find in stramonium when they have these toxic causes is that in the state of unconsciousness, they have a tendency to suddenly lift up the head from the bed and it flops back. So if you find that they keep lifting up the head and it goes back, stramonium is more likely to be the remedy. And we've seen this in practice. Iodoform. If you look at iodoform in Borik's Materia Medica, he writes it's a drug for the treatment of tubercular meningitis. The sleep is interrupted by sighing and cries. When you think of sighing and cries, the only remedy that most people think of is Apis mellifica, or sometimes they think of Helleborus. But this is another person who is very drowsy, whose sleep is interrupted by sighing and cries, and the pupils are dilated. They contract unequally and they react poorly. You also find there is diplopia. So you find that even the pupillary movements are affected. So iodoform is a remedy that you should think of when a person has dilated pupils. Remember that the tubercular meningitis is a basilar meningitis. I'm now talking internal medicine or clinical medicine. So it affects the base of the brain. And what's at the base of the brain? You have the brain stem. So you find that iodoform will be useful for such conditions when the patient has had tubercular meningitis. I saw some of my students on the chat box. They said, "Hi, sir," and I saw quite a few names that were very familiar. Some of them, one of them was my assistant from my clinic, and the rest of you, of course, have been my students. And I'm sure some of you who were there at this time will remember this case of a tuberculoma that we treated in our outpatient department. You can see this patient has a lesion here, which was diagnosed as a tuberculoma. He came straight from his village to our outpatient clinic, and we investigated him. He was definitely positive for tuberculosis. The ESR was high. He had every other feature that was in favor of tuberculosis, and the scan shows the tuberculoma. This patient was treated only with homeopathy, and this is the scan 6 months later. All his conversions disappeared within the first 4 weeks of homeopathy. And you can see that all that remains is a very small scar in the brain. This person was on iodoform. This is just for your information. So the next is the bilateral pinpoint pupils. This is usually seen in massive intrapontine hemorrhages. And this is a condition where you'll have deep coma, because we talked about the fact that deep coma is the Pons in the lower midbrain. They'll have spastic tetraparesis. That means all the 4 limbs are paralyzed or they're weak, and the reflexes are brisk. That's when you should think of drugs like opium, thuja, muriatic acid, nux moschara, plumbum, and zincum. All these remedies have pinpoint pupils. Now, thuja is a drug that we don't normally give for patients who come with or whom we have to see and who are in a state of coma. But when we find there's a miasmatic influence, when we look at the patient's past history and the family history and find that the patient doesn't seem to respond to the remedy you've given, thuja might be the drug you should think of to help bring about a change. It works like an intercurrent, and it helps to bring about a complete change in the patient's response. Now, just a simple mnemonic for or something that might help you remember pontine hemorrhages. Everything that is with pontine hemorrhage, pontine starts with P, and all the P's of pontine hemorrhage are important. Pinpoint pupils, paralysis, quadriparesis, paralysis of horizontal gaze or the eye movements, a palsy of the face, that means they have a facial weakness, they have hyperpyrexia, and the plantar reflexes are also extensive. So you have Babinski's sign is positive. So when you have this state, you know that you're dealing with a patient with a pontine hemorrhage, and you might look at some of these remedies for it, opium being one of the most important for this sort of a state. So to recapitulate, if the pupils are normal, the prognosis is good, and it could be a metabolic cause or a toxic cause. If the pupil has one dilated and the other seems to be a normal reacting pupil, the prognosis is guarded. Most likely this is a surgical case. This is not going to be used. You cannot think of homeopathy for this case. If you get bilaterally pinpoint pupils, again, the prognosis is guarded, but you could, in some cases, give opium, thuja, muriatic acid, etc., that we talked about. And if you have bilaterally dilated pupils, most of the times it means the patient is either dead or it's in the last stage of cerebral herniation. But if you find that these react to light, then there's some metabolic or toxic cause. And those cases you can treat with drugs like gelsemium, belladonna, hyoscyamus, stramonium, etc. One of my friend's father was In hospital, he had a stroke, and I was called to see him many, many years ago. There was not much that we could get from the history. It seemed to have happened over a period of time. He had, when I went to see him, he was red in the face, diffused red appearance of the face. The pupils were dilated, and we had not much to go by except for the fact that just a few days before this happened to him, he got the news that his brother had died suddenly with a cardiac arrest. There was severe grief. That was the only apparent cause. The CT scan showed a subarachnoid hemorrhage. So taking in consideration the cause of grief or bad news, the fact that the patient has a bilaterally dilated pupils, so of course they were reacting to light. The fact that he had a diffused or suffused red face, and the pathology in the brain, the subarachnoid hemorrhage. Let me see if I can show you the drug for it. The drug gelsemium. If you look at Pathak's Materia Medica, you will find in the introduction to the remedy itself, the last line, unfortunately it's covered up here, but coma and apoplexy. Let's see if I can move the screen aside. Yeah. Coma and apoplexy subarachnoid. So subarachnoid hemorrhages, you should think of gelsemium. And this patient, we were happy to note, recovered very well with gelsemium. So once again, it was homeopathy that helped. I would not say it was gelsemium. I'm sorry, it's that Vijay Vaishnav helped. It was mainly the homeopathy that took care of him. Now let's look at the lesions in the muscles or the paralysis of the muscles. If the superior oblique nerve is affected, I'm sure you remember SO4 LR6. Superior oblique is innervated by the fourth cranial nerve, lateral rectus by the sixth, and all the other are by the third cranial nerve. So if the superior oblique is affected, when you try to look for the movement of the eyes by turning the patient's face, turning from side to side, up and down, you'll find that arnica, senega, and syphilinum are the remedies for paralysis of the superior oblique muscle. If the lateral rectus is affected, so the lateral gaze is now affected, you can think of causticum, kali iodatum, and gelsemium. The medial rectus, think of morphinum. Morphine is basically an alkaloid of opium. And you should think of morphinum like opium in pontine lesions, the low brainstem and pontine lesions. So natramur, morphinum, agaricus, and conium. Conium I would think of when there's also a tumor in the brain. Conium is a good remedy for all sorts of tumors. And when you have a tumor in the brain and you have involvement of the medial rectus and there might be other symptoms in fear of conium, I would just give it, because I would expect the pathology to respond well to this remedy, because it does have a tendency to produce such pathological states. When the upper lids are affected, that means there is ptosis, causticum, gelsemium, rustox, sepia, syphilinum, veratrum, and zincum. Now, syphilinum comes up twice. You see the superior oblique as well as the third nerve. I would use it more as an intercurrent or as an anti-miasmatic than as a sort of a specific for the paralysis of a particular muscle or a group of muscles. When you're examining the patient, you're also trying to see if the respiration is affected or the swallowing is affected. Now, in case of unconscious patients, swallowing is something that you may not really be able to notice, because the patient, you're not going to make him drink something, because obviously there's a chance of aspiration if you try to pour fluids into his mouth. But at least you can observe the respiration. And if you see that the respiration is arrested, think of hydrocyanic acid. Hydrocyanic acid is one of the most toxic agents known. And in case of hydrocyanic acid, there's a state of collapse. We think of carboveg for collapse. We think of many other remedies for collapse. But here the collapse is due to some pulmonary condition and it's not a cardiac collapse. So this is something you have to keep in mind. The patient becomes unconscious. There's a paralysis of the lungs, and it's a marked cyanosis. The lungs are congested. There's a venous congestion. So there's a passive venous congestion of the lungs. Think of hydrocyanic acid when a patient has gone into a state of collapse or become unconscious, and the cause is the respiratory system. The lungs are affected and not the heart. When you have a person who's gasping inspiration and the expiration is long and slow, then you think of antimonium tartaricum and opium. If you have intermittent and unequal respiration, then again antim tart, opium, veratrum, hydrocyanic acid, and strychnine. Slow respiration, think of belladonna and opium. Chine-Stokes, again belladonna and opium will be thought of. During coma, if the respiration becomes accelerated, there's rapid breathing. So rapid breathing, bilateral dilated pupils that react only to very strong light, tendency for the head to be lifted up from the bed every time he's in a state of coma, you should think of stramonium as a remedy. In those patients who are maybe in a drowsy state, where you might be able to ask them to swallow things, if you find that there's a paralysis of the esophagus, how do you know that? Sometimes the fluid comes out through the nose, and we have remedies for that: gelsemium, causticum, again hydrocyanic acid, opium, plumbum, stramonium, nux moscata, and veratrum. These are the remedies that you could think of when a person has the lesions involving the esophagus. So let's look at the systemic clues to the diagnosis of our remedies. So patients who have fever, when they have coma and they also have fever, the most probable cause is infection, and there's some inflammation or inflammatory process that's causing it. And the drugs that we can think of are belladonna, stramonium, iodoform, and apis. I had one patient who was admitted in the hospital with pancreatitis. She had chronic gallstones, and one of them blocked the common bile duct, and she went into pancreatitis. And the pancreatitis was so severe that finally she became unconscious. She was in a septic state. She had septicemia as a result of the infection. So when I went to see her, she has been under my treatment. Her constitutional remedy was pulsatilla. But right now, when we saw her, she was completely unconscious. She had tubes going in through her mouth. She had nasal catheterization. She had IV lines going on, and she was also catheterized because of the fact that she was getting incontinent. Now, one of the peculiar examination findings here in this patient who had fever, who was obviously an infection, was in a septicemic state, was the fact that her temperature was 101, but her pulse state was 140. Usually, we know that for every rise of 1 degree in temperature, the pulse rate goes up by 10. So if your temperature is 99, your pulse should be 90. If your temperature is 100, your pulse should be 100. If your temperature is 101, it should be 110. So here there was a disproportion in the temperature and the pulse. And on the basis of that, taking that as an important peculiar state, pyrogen was given to her. Now, because of the fact that she had an oral feeding going on through the tube, she had the nasal catheter, she was unconscious, we could not give it to her orally. So we applied pyrogen in the 1M potency on the skin, and we did that every 1 hour. We started, I think, at 11 in the morning. By night, the fever had broken. Her temperature came back to normal. Her pulse started coming down to within the normal range. Next day morning, she actually started showing signs of consciousness. So from the state of being in deep coma, she became stuporous. Then she went to a state of drowsiness. And I think in 4 days, she was completely out of that state of coma. Then, of course, we followed up with Pulsadilla again, and she recovered completely. So fever is a sign of infection. If there's hypertension in this patient, it could have been a hemorrhage which caused or a stroke or a hypertensive encephalopathy. And the drugs that we think of are arnica, belladonna, veratrum viridi, and glonoin. If the pulse rate is slow, it could be a cardiac cause or a hepatic cause, and digitalis is the remedy for it. When you see petechial hemorrhages or bruising, it could be a case of purpura, maybe trauma, endocarditis, or a meningococcemia. And that's when you should think of drugs like arnica, muriatic acid, all the drugs of the Ophidia group, especially those which have a hematotoxic effect, and phosphorus. If there's cyanosis, you should think of hypoxemia as the cause, and you could think of carbovec, entimtart, and hydrocyanic acid. Now, when you are seeing a patient, you are not going to ask him, do you like sweets? Are you feeling hot? Are you feeling chilly? Because he's unconscious. He's not going to answer anything. But looking at the different signs, the importance of examination is something that I wish to highlight here. Let's look at the 3 common remedies for unconsciousness. Entimtart is the drowsy person, carbovec is a stuporous person, and opium is the comatose person. Let's start with the appearance. The entimtart is pale and blue. The carbovec is going to be blue and the opium patient has a dusky red appearance, especially of the face. It could even go almost black in color. Now, next thing that you examine is the face. In case of entimtart, you'll see the fan-like motion of the alanezi. In the case of carbovec, you'll see he's gasping for breath. That's what you'll see. In the case of opium, you find that the lower jaw hangs down. You also see this in muriatic acid. Then you look at or you listen to the respiration. In case of entimtart, there's a death rattle. In case of, what will the death rattle be like? There's a lot of bubbling inside. In case of carbovec, wheezing. And opium, It's stertorous respiration. That's because the soft palate is paralyzed. That again indicates a lesion is in the brainstem. Then you start, touch the patient now. Feel the sweat. The antemptart will have a cold sweat, especially on the face. In case of carboveg, the sweat is cold, but the head is hot. And opium, the patient has a hot head. Look at the tongue. You can prise open the mouth and look at the tongue. The tongue of antemptart is coated, pasty, thick and white. Carboveg will have white or yellowish brown tongue with aphthe. And the opium tongue is black and paralyzed. It just seems to lie inside. Feel the pulse now. The pulse of antemptart is rapid, weak, and trembling. The carboveg pulse is imperceptible. If you remember your basic first year drug, carboveg, pulse is imperceptible. In case of opium, it's a full and slow pulse. Now you auscultate. And in case of antemptart, there are crepitations because of the pulmonary edema. In case of carboveg, you'll see more of wheezing and rattling. And you'll hear coarse crepitations in case of opium. So just examination can sometimes help differentiate your homeopathic remedies. And you need to study homeopathy and your Materia Medica from also the point of view of what it does to the patient or what it does to the prover. Because the pathology that it produces, you will also find that in your patient. So for a homeopath, if the patient has gone into coma in spite of treatment, look for the causative background and look for the characteristic symptoms from the cluster of symptoms. For example, that pyrogen patient, the pulse and temperature ratio was enough to make me think of giving that remedy, and that brought about a change in the case. The causative background is, of course, the anamnesis, the past and family history, and most of the time, some antipsychotic or some antisyphilitic remedy would be useful. Now, what happens to your patient after you have given the right remedy? And what should you expect to happen? You will find that the temperature and the pulse start returning to normal, and the ratio becomes normal, like we saw in that pyrogen patient. The reflexes start returning. They start yawning and sneezing. So they are going back towards a state which is more towards a state of consciousness. If they were sighing or they were moaning, that seems to slowly subside. The physiological discharges will start appearing, like sweating, free flow of urine. And that's what happened to our patient with gelsemium. After we gave gelsemium to that patient, my friend's father who had the subarachnoid hemorrhage, he started passing a lot of urine. So the urine bag used to get filled up with urine very quickly. And if you remember, one of the symptoms or one of the indications of gelsemium is better by profuse urination. So this was more like a sort of a confirmatory test for us. It just helped confirm that gelsemium was the right remedy, because as soon as he started passing urine, his state of consciousness somehow seemed to have improved. You'll also find that there's a resumption of the sleeping posture. He's no longer just lying like a log, but he seems to be turning on his side, putting his hand on his head, or appearing to be more in a sleeping position. Now, in some of your patients, you might find that the temperature seems to go up for some time. Old symptoms come back. Like those who had been given belladonna or stramonium, you might find that sometimes the rash comes on. And that's sometimes a result of the return of the old symptoms. Some patients may complain of severe pains, or you might find sometimes twitches or jerky movements. Now, these appear to be signs of deterioration, but don't panic, keep watching. They might actually be signs of the body reacting and going towards a state of normalcy. So be very watchful. don't be under the impression that this really is a sign of reaction. If you find that the patient is deteriorating, make your change. Think of the right remedy. But in most cases, these minor changes or the so-called increase in the symptoms could just be a state of reaction, and that could be a very positive sign. I think that brings us to the end of this session. My aim was to integrate homeopathy with pathology and medicine, and also to produce or give you a framework on which you can plan the treatment of unconscious patients. I have been, when I was very young, of course, I was a resident in the homeopathic hospital. We had 100 patients in the hospital almost every day. And I have been able to see my teachers treat some of these very difficult cases. And I've had the chance to treat them myself as a resident and later as a teacher and a professor at their college and in the outpatient department and the hospital. And I know that homeopathy works. Just one difficult case you cure gives an intense sense of satisfaction. And I'm hoping that with what I've told you today, if you are able to take care of even one such case with confidence, it'll give you a lot of satisfaction and a lot of confidence. Thank you very much, all of you, for being here today. It was really a pleasure to talk to everyone and to share a small amount of what I know with all of you. I don't know if we still have time for questions, but I leave that to the organizers. If they think that there's time, we can take questions, or we can stop the session here right now.
Hello, sir.
Yes.
Thank you so much for your valuable insight in this coma cases. And I'm sure this instills a lot of confidence in us. And there are few queries if you can answer to them, because we have some time if you can.
Okay.
The first one is with regards to how would you select which potency and repetition?
So in most of these cases, we are looking at a very poor susceptibility, the failure to react. I would prefer to start with the lower potency, the 30 potency, and then gradually go up if needed. And in most of these cases, because of the pathology involved, and especially if the case is more of a cerebral origin, where there's some pathological insult to the brain, I would think of the low potency and give more frequently. But if I'm looking at a case of coma where the cause was toxic or metabolic, or because of some infection and with high fever, then I would usually start with either the 200 or the 1M potency, and I would still give it frequently because I want to bring about some sort of a reaction.
Okay. Another one is, what would be the best mode of administration of this medicine? Would it be olfaction, or by tactile stimulation, or by a nasogastric tube?
Right. So as I told you earlier, in that patient where we gave pyrogen, I had to ask them to apply it on the skin. Most of the cases, you can just use olfaction. That is going to be much quicker than using it on the skin. All you have to do is open the vial of the potency, whichever one you want to give, and just hold it under the nose and allow the potency to actually go into the respiratory tract, and that should be enough. What's interesting is there was one patient in our hospital that I had admitted for a pneumonia. She was severely breathless. She was not unconscious, but this is just an aside. And the chest physician attached to a hospital said she needs nebulization with steroids and bronchodilators. And I said, yes, we'll give a nebulization, but we will not use steroids, we will not use bronchodilators, and we use Blata orientalis mother tincture. So we use that as a liquid in the nebulizer, and we use that every 3 hours. And the result was just dramatic. So instead of giving mother tincture orally, we actually nebulized this girl with Blatta orientalis, and we saw a super great response. She had pneumonia involving the middle lobe of the right lung. The remedy, by the way, for that is medorinum, but that was given only in the form of single dose, and we thought of giving her Blatta orientalis as a nebulization. So you have to decide which is the best route for your particular patient depending on what is available. If the nasal tract is blocked, if they're on a ventilator, or if they cannot swallow, of course, but if the mouth is also covered with, or there are tubes inside, then the skin is the best option. Otherwise, olfaction would be the ideal way of giving it to such patients.
Thank you. Have you also tried, sir, anytime LM potencies in such cases?
No, I haven't.
And if you can briefly tell us about your model of studying Materia Medica, or the way to study Materia Medica and relating it with medicine, so that we can also try with the same with different subjects.
That is going to be one more lecture. It can go on for hours, because every drug that you study, see, I'm a very big fan of C.M. and I give a lot of importance to the locations and the regions, as well as the pathognomos state. So you look at what is the region, what is the pathogenesis of the remedy, and then you will find that a lot of your guiding symptoms become very easy and which become very prominent and easy to understand. So any drug you take up, you'll always find there's a sphere of action, there's a pathogenesis, and from that you can derive the symptoms of the homeopathic materia medica. Let me take a very small drug like millefolium, for example, a very small remedy. Now, millefolium is a drug that has an action on the capillaries. It doesn't act on the arteries. It doesn't act on the veins. It acts only on the capillaries. And so that's the sphere of action. What is the pathogenesis? The pathogenesis is that it causes a fragility of the capillaries. They're extremely fragile. They break easily. And what would happen if they break easily? The slightest injury, the slightest movement would cause them to break, and it would lead to hemorrhages. And because these are capillary bleeds, they are not going to be gushing. They are not going to be dark in color. They are not going to be brighter dark in color, but they'll be just constant oozing of blood. So if you look at the materia medica of millefolium, you will find that there is easy bleeding from the slightest injury, from the slightest misstep. The blood is bright red, blood just oozes out, and this is without anxiety, because the patient doesn't even sometimes know that he's hurt himself, and there's just a slow ooze that comes out. Compare that with aconite, which has bright red blood, gushes out, and which is associated with severe anxiety. So every remedy has a sphere of action, every remedy has a pathogenesis, and if you study both these things in the remedy, you make it very easy to understand the homeopathic materia medica. And once you understand the materia medica, it's easy for you to put it in practice. What you should also keep in mind is do a lot of remedy relationship. Compare and contrast remedies. That's the key to expanding your knowledge of materia medica.